So this is a nice one just to follow on from our breathing tutorial, just to help you find a little bit more ability to voluntarily recruit the inner core, that corset muscle along with your pelvic floor. So we're thinking about that. Do you remember with that breath out, how everything naturally just draws towards the midline in that lower abdominal area, through that abdominal wall and through the pelvic floor? We're now going to get that recruitment and be able to maintain it whilst we breathe. So again, I'm going to use my handy book. We're going to lie down on the floor. I'm going to move the camera back a little bit. Maybe you'll be able to see me a bit better. Okay. We lie down on the floor. Again, put something underneath your head if you need to, because if you do this exercise with your head kind of all tilty back like this, then it's not good for your neck, and it also puts your neck in a not great alignment to be able to get back the strength of the deep neck flexors, which are again really important for getting your neck posture back. So put yourself into a good alignment. You'll feel like the neck is long at the back, it's nice and straight at the back. Your chin is not pointing to the sky. The chin is nice and neutral. We're going to put our book onto the lower abdomen. This is going to be what you're going to feel for when you breathe out. And then make sure you're nicely on the floor, neutral rib cage, neutral pelvis if you can. And I've also turned my toes to the sky. I find that really helps with getting a little bit more sensation of the pelvic floor. So if you turn your toes to the sky, so you're kind of resting on your heels, then that can also be a really nice, helpful strategy. Now, hands on the side of the body, just so you can make sure you get a good, efficient inhale. I want you to send your breath through your nose into your hands so that your hands open wide. You're going to feel a natural expansion of the torso in all directions, and the pelvic floor is going to give a little bit of a stretch. Now, keep the belly soft and the pelvic floor soft as you inhale to ensure that happens. If you find when you breathe in, you are expanding wide into your rib cage, but your belly and your pelvic floor didn't expand, it means you're probably gripping and holding tight your tummy. So let those tummy muscles and pelvic floor muscles relax. They should be passengers on the inhale. So we're breathing in for a count of 3. And then I'm going to get you to pause, and I want you to send your breath back from that lower abdominal area. So feel that book pull gently towards the floor. Once you've got to the end of that exhale, I want you to pause, and you'll feel that tightness through the abdominal wall, pelvic floor is involved. Now, what I want you to do is to return to normal breathing, but I want you to keep that book gently pulled in towards the floor. It should only be a gentle contraction. We shouldn't be gripping with all our strength, just enough that you can still feel that there's that little bit of tension through the abdominal wall. Now, I am talking so you know I'm breathing, but for you, I just want you to keep breathing normally and naturally. Don't hold your breath at any point, and just see how long you can stay with that contraction for. Now, I can stay with it for ages because I've been doing this for quite a long time. For you, that might only be for a few seconds. That's fine. That's your starting point, okay? At that point where you begin to lose that contraction, you just let it go. Take your breath in, let everything open wide, give it a little bit of natural stretch to those muscles. And as you breathe out, I want you to find it again, gently drawing that book straight down towards the floor, till you feel that little bit of tone wind up through your abdominal wall. And again, maintain it whilst you continue to breathe. And over time, our goal is to be able to bring up the amount of time that you can stay in that connected position for, while still feeling nice and gently connected, but being able to breathe at the same time. That is sometimes the most challenging bit, is to be able to breathe whilst being connected here. But if you practice that now, again, it's going to serve you well in preparation for other exercise. I find if people haven't got this right, then what they do is that they grab a load of breath when they go to perform a core challenging movement, and they hold their breath and they push their belly out, and they really just grip through the superficial abs, and you know, this is why we have a lot of trouble then really building up our foundational strength, is because we're using all the wrong bits. So try and get this right now, and it will really help you later on. Okay, so again, we're going to breathe in nice and wide. Breathe out, draw your book in towards the floor. It's not coming up towards your chest, it's coming towards the floor. Get that connection, stay connected with it. Keep breathing. Stay with it as long as you can. And then breathe in when you're ready. And again, breathing out, drawing the book towards the floor. Stay with it. Count your breaths, keep breathing. Are you doing more breaths now than when you first started? Breathe in when you're ready. Breathe out. Make sure that the pelvis and the rib cage, they're all staying in the same alignment. If you find yourself you're tucking under, just bring yourself back to neutral. You should stay neutral through this exercise. You should not be tucking your bum. If you're tucking your bum or you're tensing your upper abs, again, your body's trying to help you with compensatory actions. So just tune those out, stay neutral, put a hand on there if you need to. Anything you need to do just to keep everything neutral, go with it. We want it to all be about this center here. It's your pelvic floor and your transverse abdominis, that corset muscle. Those are the bits that are activating, providing that little bit of tension. You'll feel that natural little bit of lift inside. And you're staying with it. Good. Now breathe in when you need to. Breathing wide into the torso. Tummy relaxes, pelvic floor relaxes. Breathe out, find that connection. Book draws straight down towards the floor, nice and gently. Good, stay with it. Breathe in underneath. The breath is very low down. It's not coming up here so much. Breathe in, let everything relax. Let the pelvic floor and the tummy muscles stretch wide. Breathe out, find your recruitment again. Breathe underneath it. Breathe in, let everything relax. Okay, and if you're starting to get the hang of that, and if you're getting close to if you're getting around that 6 weeks postnatal mark, again, that is kind of going to set you up for how you connect to your inner core when you perform exercise. You should start every exercise that way. You should find that connection and then perform the movement on top of it that you were supposed to be doing. Make sure that this recruits correctly first, just as you did there with that book. Make sure that that is always the first thing, because again, when things are working correctly, the order should be stability at the center, then movement on top. That will then allow all the other muscles to do their job much more effectively, and you're also going to have much more control at the center of your body and around your pelvis. So when you're doing exercise, you're reinforcing good movement patterns. You'll reinforce, and you're also, by connecting there, allowing everything to tone up correctly as well. So again, if you're before your 6 weeks and you're feeling okay to begin doing this, again, then it's quite a nice one to get started with. Listen to your body. If you're getting any pain around stitches, or if anything doesn't feel right, then obviously just stop and talk to your local healthcare provider, so your GP or your local physio, to get more individualized advice. But again, this is a lovely one to start connecting with early days in preparation for when we then do other exercise. And that feeling of that activation there, this is also something to use through your functional tasks. So when you go to turn, think about breathing out, finding that connection. It's going to support you better as you turn. When you go to get out of a chair, or when you go to get up from the toilet or the floor, think about breathing out. So you're finding that little bit of connection here at the inner core. So that as you perform that movement, firstly, you're lifting pressure off of your pelvic floor, so much better for your postpartum healing, but also it's starting that process of making sure that these muscles that are supposed to recruit just before you move, they begin to remember what they're supposed to do, and it will make your movement easier and more efficient. So a great thing to be aware of and to start working in and training as soon as you feel comfortable to do so.